and good evening. I'm Melissa Idris. Welcome to Agenda AWANI. Now later this month on the 25th to the 27th of October, the Ministry of Health in collaboration with KPJ Healthcare will be hosting the Malaysia International Healthcare Megatrends 2024. It's going to bring together some of the leaders in government, healthcare, private healthcare and technology to explore what lies ahead for the industry. Now today on the show to tell us a little bit more about the trends that are set to revolutionize Malaysian healthcare, we have Health Minister Datuk Seri Dr. Zulkifli Ahmad and Chin Kiat Chuan, President and Managing Director of KPJ Healthcare. Gentlemen, welcome to the show. It's good of you to join me today. Dr. Seri, Dr. Zul, may I begin with you? Talk to me a little bit about the this Malaysian International Healthcare Megatrends. It's a mouthful, so I'm just going to say MIH Megatrends. What was the thinking in trying to put together such a big a host of distinguished speakers and thought leaders in a room to discuss healthcare trends? What was the thinking behind this?
Right. Thank you, Melissa. Thank you again, my strategic partner, Mr. Chin. Yeah, post-pandemic, we surely now out of the pandemic of infectious disease, but went straight into the pandemic of chronic diseases, which is the pandemic of the NCDs. Right. And that is even more daunting, as you very well know or may not have known after our NHMS National Health Mobility Surveys of 2023. The pandemic of chronic diseases or the pandemic of non-communicable diseases is going to really be even more challenging than the one that is by its nature acute and episodic. That is infectious disease like SARS-CoV-2. Comes and it goes. However, the more challenging one that will really test, our tenacity, ability, and capability of our healthcare system is the one that is lifelong. And with that four matrices of the risk factor, I can put it simply by saying that it is a global challenge. Hypertension, hypercholesterolemia, diabetes, and of course, one that is not going away is overweight and obesity. These four risk factors is the number one in concert, the killer or the number one killer by way of premature death, meaning you die before you're supposed to die. And that is coming very, very alarming to say. And the heavy burden of this diseases is to the tune of billions. NCDs is in fact the latest data from WHO. Looking at Malaysia, the direct and the indirect cost is indeed costing us 62 billion per year. I only thought it was about 10-12 billion. But now that you see the entire total aggregate of the cost, direct and indirect, including loss of productivity, absenteeism, presenteeism, or whatever. So this is a great challenge. And it is timely that we bring the best brain, the best mind, the most experienced clinicians, researchers, bring it together in what we want to believe is going to be our signature event.
Wow. Okay.
Yeah, the like of the Dubai Health Forum, where we get to have the best, talent, the most, experienced hands in healthcare, and as well research, and bringing together a latest, of technology. And to have this conversation on a more concerted platform of serious exchanges of insights and research.
I like the thinking.
And changing protocol, changing whatever that, and exchanging this, and to frame it that you see thematic approaches. Namely, perhaps, one is, of course, the financial aspect of it. How to be sustainable, in the longer run, when particularly like Malaysia, we are essentially a tax-based system. Would you be able to sustain it further? When of course the challenge of getting sources and resources and budgetary allocation, when you are constrained by fiscal space. So that is one. Do we have other sources of financing to make it more sustainable rather than looking at the consolidated funds or tax revenues? That's certainly one big theme. Then how do you go about doing it? Secondly is, of course, to see how, when you cannot rely only on public spending, in the sense that public spending is about 2.3% of GDP, while the private sector we really hope them to come in, all hands on the deck, for them to increase their investment into this. As an upper middle income economy, we have to at least bring it higher, not just for now, and we have plateaued for quite a while now at 4.4. No, we should be spending there about almost 5 to 6%. There's been a kind of a perception, not just perception, it's quite true that we have been underspending. Yeah. But be that as it may, moving forward, how would we then, get and woo in, and nudge the private sector to be spending a bit more, and that, of course, have got to come with some very good program, and I would be able to talk about it, for them to see that, it is, it's a opportune time to invest, and that certainly is about, the entire thing on health financing reform, and we want to hear not just about us, we want to hear from the experience of other jurisdictions from this, from Europe, from the Middle East, from Australia, from the state, and as well, that is why the meetings on mine is so very important. So we have one, health financing. Certainly the other would be a public-private kind of collaboration. How do we get to intensify that? And perhaps third, not the least is, of course, on technology. How would then, particularly from my perspective, in respect to my vision of getting a national EMR or lifetime health record, and what is it, and how would it be that we want to learn from the experience of others, not just what they are successful, why they have failed, so that we will not go that route down, So that would be technology, and particularly, of course, where AI, especially generative AI, is going to really help us by way of, making precision patient care. And I would want to also talk about the precision public health, or precision population care, population management care, we call it PHM, population health management, or precision public health. So I think these three alone would be more than create the excitement, the conversation, the debate, and the exchanges, which I think is going to be mutually rewarding, insightful, especially coming and inviting renowned names that we would like to see. So with that, that came, the backdrop to all this is I must attribute this to KPJ, especially Mr. Chin. He's so dynamic, he's so forthcoming, and he's so proactive. Yes. And when he posed it to us, we have got no choice but to embrace and to accept this as the way forward. But I love that it's coming
from both private and public.
Exactly.
This is PPP in action,
right? Really.
Yeah, so I really like that. And I'm very, I really appreciate you highlighting the fact that this is post-pandemic. We are done fighting the fires of the pandemic. Now is the time to think strategically to the future. So it's a great time to be bringing these minds to think about future trends and how Malaysia can benefit them to the maximum of the potential. Let's ask you, Mr. Chin, when you think about this, all the points that Dr. Zul has just raised, all the key themes and trends that are going to be discussed at this gathering of great minds, what are you most excited for? What are you thinking will be most beneficial for not just private, but public, all of Malaysian healthcare to explore?
Yep, thanks, Melissa. I think, first of all, allow me to really thank YB, because YB truly inspired KPJ, right? With the shared value of what YB have actually shared about this so-called value-based healthcare, right? That's the signature of YB, right? And it's a line-minded. Yeah, KPJ also very much. From day one itself, when I joined KPJ, I always put patient in the center of everything that we do, right? So value-based healthcare is always about patient-centered care, right? How are we going to put every effort together in enhancing, elevating standard of care for our patients? And I like the way how YB mentioned that it is about high time, post-pandemic. How are we going to elevate the standard of care for Malaysia healthcare to the global platform? I think it's about time for people to recognize, right? Malaysia, we are not only as the preferred destination when it comes to health tourism, but truly internally, I think through the years, there's a lot of good work we have actually done. But we, as usual, Malaysian, right? We are very, very subtle. We're doing it in our way. But it's about high time for us to actually share it out, right? Advancement that we have actually gone through and how that will then eventually help to promote the healthcare space. It's just like how the Arab Health that YB mentioned, the World Health Summit that we are talking about in Berlin, and even though HIMSS, right, we're talking about the Health Information and Management System Society in US. I think this is how Malaysia International Healthcare Megatrends is going to be another signature program year on year. So I think that really excites KPJ. And I like the way how Melissa, you said, this truly is another great example in reality, how PPP spirit being bring to real life. I think that is actually where we are. So looking at what the teams currently, that really excite me, I think looking at how the digital, as what YB mentioned, whether you talk about generative AI or on the predictive, preventive, and also precision medicines, I think that piece is about time for us to really drill in. Now, providing world-class clinical services, I believe a lot of people can do it. But how do we do it in the sense that we provide a platform, allow the best-minded professional all comes together and share the best practices, right? They are going to even talk about the real-life evidence through their studies. And I think that would actually help to really stimulate that kind of a thinking, you know, for our professional to be able to get in. So clinical service is one thing. I think research, allowing our platform for professionals, policymakers, our providers, together with, you're talking about innovators, how they all can come together, right? And elevate that standard of care to the next level. I think that to us is very, very critical. So if you ask me, Chin, what excites us and what we would like to see as an outcome from this Malaysia International Healthcare Megatrend, we would like to see how it can actually help putting Malaysia into the world map. And Malaysia providers, Malaysia industry in terms of medical device, pharmaceutical, will be able to collaborate with global innovators and through researchers and innovations, elevating our services to the next level. I think that would be exciting.
Okay, so quite interesting. When you talk about the technology part, if I just may follow up, how so part of it is really looking at how healthcare technology and digitalization can augment Malaysian healthcare. How are you thinking? Like, give me an example of how it could. What are the promises of generative AI, the promises of digitalization and healthcare technology that you see could be ours in the future?
If I may, YB, yes. I think one of the area when we're looking into AI, for example, is a genomic mapping, for example. Today, a lot of people talk about precision medicines. Now, precision medicine is all about personalized treatments, right? And integrate that healthcare from the pre to the intra to the post. How these three things all can come together and utilizing AI to actually cut short and also increase the predictive side of it. I'm really excited about it because especially when we're talking about minimally invasive procedures nowadays, how the robotic piece is actually comes in into big pace. People used to talk about only prostate surgery, radical prostatectomy surgery, using a robot. But it far beyond that. Today, people using robot for arthroplasty, total knee replacement. I think all this technology really help to change the way how healthcare is going to be much more personalized and enhances the precisions And that is actually how we're saying that the patient's journey and the experience is going to be further enhanced.
That's so interesting. Dr. Zul, what do you see as the promises of digitalization and this future healthcare technology for patient care in the public sector?
Right. You may or may not realize that despite our effort, and supposedly we should have what we call as the movers or rather first mover advantage. You know, we launched our multimedia super corridor in the 80s and early 90s. We have had our first Selayang hospital to be touted as the first paperless hospital. However, this is quite true of Malaysia. You know, we always take the lead in the beginning, and somehow we lost.
We lost our lead. Oh dear.
And then, you know, now I must say that the centerpiece of digital health is actually what we do not have as yet, and that is the national, the EMR, the National Electronic Medical Records, or on a longer term we call it the lifetime health record. So you can talk about anything else digital by way of its wearable, by way of AI, by way of, you know, but that centerpiece, I call it the strategic centerpiece of an EMR or a national EMR, is almost like mandatory for us to have it. And the last pandemic of SARS-CoV-2 not only strained our healthcare system, but it in fact actually revealed and unfold what serious defect or absence. And mind you, we do not have a digital health. We do not have the national EMR, and that in a way incapacitate or handicap us to be managing our patient by way of them having a patient summary, or we call it patient master index. And we were struggling with with MIH Megatrends, which finally came out to be as a contact tracing in the beginning, but now with terabytes ability could form the data basis for what it would then be integrated into the national EMR. But that is an app. But what is important here, if I may, we want to also get to know how others, getting through this. National EMR is no longer a rocket science.
Yeah.
It has been around, and we should have it. My first term around, 5 years ago almost, I've already announced that we will be getting it. Coming back this time is like full cycle. I'm still almost where I am. So I must say, Malaysia, the most important thing is for us to get this enabling, empowering national EMR or lifetime health record, for it to make it meaningful for other technologies to be, adjunct to it or attached to it or integrated with it, so that we could really, address not just patient care within the curative care of hospital, but as well, as I said earlier, I alluded to, on the population health management, which is a public health, kind of management of healthcare and health outcome. So I would want to believe that we would be also listening to many experiences of jurisdiction like the UK. Like the UK, they were of course a lot earlier with the national EMR, but we have also learned that it wasn't easy. It's already in the news that they have spent billion and yet not, still, and as well others. So I think this is one occasion where we get to hear and listen and learn. And of course, a big organization, premium organization like even KPJ, you have your own, of EMR within their how many hospital? 32?
29.
29 hospital. But how I see this is that we must finally get to making it seamless with the integration and interoperability of both vertical, both horizontal integration and as well vertical integration of clinics to hospital, primary, secondary, tertiary hospital, and it's finally public and private interoperability, which will make our facilities, every citizen, one record, they can be going to anywhere of our facilities in the nation, and yet everything is in this machine, a patient master index of a summary of their medical history, what have you, so that each patient should only be asked, if I put it nicely, the same question once, because it's already all there. So with that, that will be the empowering digital ability that we want to see. Then came everything else, then come everything else of AI, of all others, and making telemedicine, making clinical care around the telemedicine closer to home by way of our virtual clinics and whatnot. All of it will come in place once we see this strategic heartbeat of it all, the national EMR.
So Dr. Zul, is the vision that one day I can walk into a clinic kesihatan and then go be referred to a hospital and then have follow-up care in a KPJ hospital with just my phone? Is that the vision?
Of course.
That is the vision.
That is what, in a nutshell, interoperability, ability to again access through, trespassing or rather crisscrossing, or even, in all organization, all kind of facilities. Of course, that is the ultimate of what we want to achieve. But we have got to start this journey, and we are already, we are going with this in Malaysia by way of our MIH clinics and as well our hospital. Fantastic. Of course, private hospital are already there, perhaps earlier than us.
But we have to get the foundations right so that we can achieve the potential of all the things
the
that
ultimate
AI
is
can
to
do.
have interoperability. Otherwise, we are all in silos.
Excellent. Okay, we're going to take a quick break and we'll come back and discuss more here on Agenda Awani. Stay tuned. Hi, welcome back to Agenda Awani. I'm Melissa Idris and I have with me here the Health Minister, Datuk Sri Dr. Zulkifli Ahmad, as well as Mr. Chin Kiat Chuan, who is the President and Managing Director of KPJ Healthcare. Just before the break, where we were talking about some of the key focus areas for the Malaysian International Healthcare Megatrends 2024. And one of them, which is really exciting, is precision medicine, genomic healthcare, advanced cellular therapeutics, big picture, big thinking strategies. This is exciting to me. It must be exciting to you in the industry. Dr. Zul, may I ask you, how do you see precision medicine being incorporated into the public health thinking of Malaysia?
Right. Earlier on, Mr. Chin has already alluded to the fact that, the centerpiece or moving forward, the technology that is most exciting is finally to get to unleashing and unplug the potential of genomic medicine. And we, in our little ways, by way of MOH and MOHE, and even mostly for that matter, we have started to work together to, in fact, embark. And the Human Genomic Project, way back, is complete, right? It's completed, and on a effort to now generate our own reference genome, we call it. Malaysian, we must also, first and foremost, to make it meaningful, is for us to have a reference genome. And that is a reference genome for Malaysian. That will allow us to have what is known as the normal genome. And any disease, inquiry or investigation, and learning to understand trends, learning to understand why such a population are more susceptible, more predisposed to a particular a disease like cancer, or even for that matter, cardiovascular, diseases, or we call it atherosclerosis, ASCVD. So, all in all, they are all like contained in our genomic makeup. So, if we get to understand first this reference genome, okay, then we are already undertaking it. MOH with MOSTI and MOH with, even for that matter, with MOHE. And they have got their UMBI with the Molecular Biology Institute. We want to really invest in this. And already we are also looking at, let's say, of another, effort. This is a bit more international effort by way of the effort with, I may not be able to say it for now, not reveal it for now, but globally, it is genomic medicine.
Wow.
Because if we are able to address that, then we will have a way to intervene. In fact, intervene in a preventative way. And of course, if I may just say that even certain disease condition are essentially, and a lot of it is genetic in origin, and in fact even in epigenetic or causes or causality, they are also tied back to gene. So it is here that we must really spend time to understand this, because if we get to understand, particularly over diseases like inborn errors of metabolism and many others that have got direct genetic thalassemia, you name it, the whole range of diseases, they have a genetic predisposition. Therefore, it is this that big pharma, everyone, is just looking into how they can unleash this to finally get therapeutic intervention, curative, and even, in fact, preventative, where they go, like genetic counseling even before marriages and whatnot. So this is why it is so exciting. It's just not like fighting, in the sense of a sick care or curative care. This is really preventive, promotive, and into what we call as wellness. So you get to screen them even before, well before it happens. So I could just only simply say that, but yes, genomic, the characteristic of the genetic variation of our racial makeup also would also be unleashed. Yeah, it is. This is why it is precision medicine. Actually, precision medicine is more related to genomic medicine more than other things. Of course, there are other things of making clinical decision very fast through digital, to EMR, to whatnot. But precision medicine is essentially genomic medicine.
Right.
That's where you get to see what is the causal or the cause of diseases and the progression of diseases, the prognosis of disease, how is the outcome, and then the intervention, pharmaceutical intervention, drugs and whatnot. Now they're becoming more targeted, and even in cancer, they have the immunological, immunotherapy, which is more precise.
Yeah.
So they're all getting more precise now. So that is aided by genomic medicine. So I think, I'm quite sure this will be one of our thematic preoccupation to look into.
Fascinating. I'm sure this will be an area of rich discussion, particularly if, as Dr. Zul just mentioned, we're thinking about it from a population perspective. Right. You can imagine the data and thinking about
I'll excite you further.
Yeah, I'm sorry. I'm very excited about this.
How many can a super duper cardiothoracic surgeon put on his table? How many patients? One. How many? Or how would a public health physician? Sorry, yeah. I'm going to be. I may be angry. I may be causing some people to be a bit more upset with me. But how many could a public health physician in their in their decision to provide solution in matters of policy, in managing population health management, it's into the thousands, if not millions, right? So it's so very important that public health physician is also aided, beside those in clinical settings, in curative hospital care. We are also empowering population management by public health physician through data that we create from the EMR, you know, from lifetime health record, and using that and unleashing this to do what is known as therapeutic intervention of precision public health, which is to put the correct intervention to the correct population or even subpopulation at the correct time to get the best outcome by way of handling both infectious disease and as well chronic NCDs.
Very exciting times. Can I ask you, bringing it back to what we talked about a bit earlier, the potential for public-private partnerships, and that's going to be discussed at the forum, right? The idea is to go beyond just talk and to have it materialize as real collaboration between private and public sector. How do you see this happening? I mean, this is one area that is so rich to be mined, but do you see other areas where private and public can come together, particularly because Malaysia has such a unique healthcare structure? Yeah,
that's right. So if I may, I think YB have just mentioned something very, very rich in terms of the 3P, right? The preventive, predictive, and also the precision medicine. YB have actually touched a lot on the precision medicine, which is actually related with the genomic. I think the two parts that YB have actually touched on, when you're looking at genomic, how that can actually allow us to do a bit more data grind, right? So that we will know how to predict, right, certain things. I think healthcare is very expensive, YB, especially in Malaysia, public health, right? 40 over billion. But how much more we can add, right? YB just mentioned 4.4% GDP. By right, we should be looking at 5 or 6%.
Yeah.
But there's endless to it, right? I think towards the end, I always pay attention to what YB actually shared. I think instead of focusing a lot on the sick care, that means people sick, then only we intervene into treat. The wellness is actually something that the preventive. How do you get yourself not to get into that situation, right? Driving awareness, driving preventive, changing lifestyle, I think that is actually the ultimate goal, what I think YB you're looking at, right? And that is the part. Yes. Truly we can see private can actually partner a lot together with the government in driving towards that. Because I like the way how YB mentioned, how many patients can a cardiothoracic surgeon do at one time, right? It's only
sorry,
one.
I've got to cite that example, right? Yeah, sorry.
And yeah, so yes, and as of today, we still have thousands of patients still lining up, right? Seeking for treatments and all. And another example, as what Melissa you're asking about PPP, is the decanting service that the Ministry of Health has been doing. And as the private healthcare providers, we are more than happy to serve because ultimately we have the capacity. And especially for KPJ healthcare, we do have 29 hospitals across the country, from Perlis all the way to Miri and the Cebu. So not only in the big city, tier 1, tier 2, we do have accessibility for all the patients. So when government is looking at not only cardiology, cardiothoracic, nephrology, and some of the areas, this is actually where, yes, radiology. So we certainly can be partnering with the government, again, demonstrating how healthcare should be once for all and all for one, right? It cannot be only counting on government, one sectors to actually drive. Private need to come in, work hand in hand together with the government. I think that is actually what the message we're trying to send out through this MIH Megatrends.
Yeah, and I see it reflected in the lineup of speakers, in the way the topics have been curated. One of the things that I was happy to see was a focus on value-based healthcare. Right. I know that is your passion, Dr. Zul. And I wanted to bring that up, and I wanted to maybe you can lay it out for us where you see value-based healthcare and how it might differ from the current traditional, the traditional model that we currently practice. what is being discussed at? What would you like to see discussed at this forum?
Right. This is not even a novel buzzword in healthcare. It has been quite a while.
A while,
Yeah, redefining healthcare. I can't recall the author of the book though. Even Eric Topol also, Dr. Eric Topol, the renowned cardiologist, also wrote such thing. Wrote such thematic emphasis on value-based. Right. In essence, what is value-based healthcare? It is healthcare that, simply put, that would have to be premise payment or pricing, or pay not for procedures or services, but pay for outcome.
So right now we have the pay for service or
it's pay for service. Okay. It's pay for service. So it's pay for service in the sense that the more procedures you're going to carry out on a patient, of course,
you have to pay for it.
Yeah, the more you get paid for that. Well, that may be like assume that is a situation where especially if you are insured, right? So you're going to be paying it through your insurance, and the way insurance are also getting a bit more nervous is because when they have to bear all this, that they will eventually raise the premium. And of course, if they do that, then those who are on insurances, whether it's employee, it's not employee, private health insurances, if they decide to only pay from their out-of-pocket expenditure, then you could also anticipate that there'll be more making beelines to our public hospital, and that will further congest our public hospital. So, if that inflationary or medical inflation in the private sector is going to be, unmitigated or not, I do not want to say control, but
it gets higher, right?
It gets higher. It's about 12.3%.
It's runaway inflation.
It is 12.3%, opposed to a national average of 2 to 3% of goods and services. We have in healthcare 12.3%. So why the need to emphasize on value-based healthcare? Of course, more than one reason and rationale for doing it. Of course, the best, simply put, to understand it's actually making sure that efficient, use of resources and in fact procedures be exercised through prudent clinical decision, such that the best outcome of a patient experience and patient's health outcome is determined through a differential treatment or what have you, through the procedures, that you get to have best value for money rather than by way of say certain procedures like appendectomy, example, appendicitis, you get to do that, and then you have a lot of complication at the end.
You say that this is around. This is it's been around for a while. That other countries practice this as well.
Yes, and I think we are all moving in that direction.
Okay, the kind of global shift to that.
It is a global shift. It is a buzzword that everybody would like to identify with. And when I mooted the idea, it was none other than IHH, and I'm sure KPJ as well would want to see what value-based healthcare means. And I think this is an occasion to the Megatrend, MIH Megatrend, that we will be listening to great minds, or the economists, health finance, health economists is going to be hopefully dwelling on this, so that we get to understand. And I wouldn't want to complicate further by going into DRG or CRG or case mix and how you get to replacing the pricing and whatnot. I think that's a bit more difficult, but a bit more technical to understand. But be that as it may, what is most important for us to understand that you can't be charging for, simply pay for service continuously, because you're going to really create inflation by way of, the cost can be spiraled into, especially when procedures have got a lot more complete procedures, or what was supposedly to be quite, is complicated by other procedures that got to be, put in and instituted. So we have got to really exercise a value-based healthcare, so that we get to really control and manage healthcare, rather medical inflation. On top, I'm just giving that as one factor. Medical inflation is multifactorial. As you very well know, there are costs to pharmaceutical, there are devices, there are procedures, there are clinical procedures, and there are thousands of clinical procedures there are. So all those must be addressed, and of course that also attached to the fee schedule of the Act of 586 and others. So Jadual 13, Schedule 13 and whatnot. So I think, in a nutshell, we would want to see that this topic is debated and
so further discourse on this topic.
More deep diving into by the expert, and we will have a way to exchange and insights. And of course, we want to see most of these things would be data-driven insights and data-driven decision that we want to arrive at.
This is the platform for discussion for that, Mr. Chin.
So I would like to build on what YB mentions, right? When it comes to value-based medicines or healthcare, how private actually looking at it is not much difference than what YB is actually focusing, because we are all focusing on the well-being of our patients. And one thing for sure is we are not compromising anything to do with quality of health. So though there is a serious conversation now between the cost versus the outcome, and value-based healthcare, one of it is actually outcome-based healthcare also they're looking at. And we are not compromising on that. So especially for KPJ, if you're looking at it, we always put patient in the center. And in fact, I like the way how YB mentioned just now about empowerment. I think we always wanted to invite patient also to be part of the decision makings. So it's no longer like you are talking about 20 years ago, where the hospitals and the doctors say everything and the patient have to really listen, right? Today,
patients are now more empowered.
Today you look at generative AI, right? You just ask, you'll get tons and tons of information. So I think with the cutting edge kind of technologies and also informations, it is no longer there, right? So when we are looking at all this, what we are actually trying to do is we are trying to see that how we can collaborating together with policymakers as a government, Ministry of Health, how we can be partnering with our payer, because as you know, other than out of pocket, we have insurance who they are the one who is actually paying for it. How do we put together patients as part of the decision making, and more importantly, the physicians, right? So if we put all this piece comes together, I think that is actually where, without compromising on the quality, putting patient in the centers of everything that we do, I think that value-based healthcare is going to be there. And especially Private Healthcare Act currently, right, which is focusing on the private providers, we can't charge anything beyond, right? The fee is actually fully controlled.
It's fixed, right?
Yeah, it's fixed. It's different than some other countries. Some other countries
it's not fixed as such, but there's a bracket.
There's a bracket.
There's a cap.
So in fact, if you're looking at hospital bill, most of the time, the doctor fee is actually less than only 14%. The rest of the fee, a lot of it, I think big chunk of it, YB, if you allow, is actually more related to medical device or pharmaceuticals. Yeah, so there is a lot of others where we know that post-pandemic, because of supply chain hiccup and all, there has been a significant increase in terms of the supply chain costs and all this. So that those are the things which is separate, but we will certainly bring in all the experts and have a conversation into getting different healthcare system. How do they look and view based on this value-based healthcare system?
Yeah, so I do want to ask you, I mean, the idea of bringing everyone together to discuss kind of mega trends in healthcare is fantastic. Innovation is always exciting. The prospect of innovation is always exciting. But for the people watching today, we all know that Malaysian healthcare has immediate pressing needs. So while we are thinking about the future and future strategies and big ideas, there are many that think, we have immediate practical needs in Malaysia that need to be addressed. Dr. Zul, how would you allay those concerns?
Right. And this is not, it's an open secret that finally, Ministry of Health is essentially a very facility-based. We have 149 hospitals and 3,200 over clinics. I think private sectors have got more. You've got 200, and you've got 200 hospitals and 7,000 over clinics, GPs. So. No denying the fact that at the end of the day, all these big things on reforms and whatnot will not be the way people look at me. How they judge me and give me brickbat every day is when they see facilities, people making beeline from early morning, and congestion, whatever. So that's how they judge me. What good things I want to do by way of health transformation, health financing transformation, which I have not touched for now, or even the digital health transformation or EMR that I aspire and hope to vouch to do. Yeah, correct, Melissa. The point is two things. One is, of course, on facilities. The claim is we have been underspending, but to be honest with you, I wouldn't say that we are that bad after all. Yeah. I can, even though we are underspending, true, we have been, lot less from what we are supposed to be as an upper middle income economy. But you look at our facilities. Some of our facilities now I'm beginning to understand when I'm doing outsourcing that when we compare with the capability of the private sectors, not too bad at all.
Okay.
Which is quite good.
Okay, public, and finally, I'll tell you honestly, when it comes to very complex cases, patient would finally be sent to, referred back to us. So, okay, however, be that as it may again, when it comes to congestion, when it comes to, to waiting time to see, especially on the elective surgeries, not the emergencies. The emergency you get no wrong door policy, you get to be treated immediately. But when it comes to elective kind of procedures, elective surgery and others, yeah, that would be with time. And of course, oncology, of course, when you cardiology, yeah, you have. Hence the reason why we outsource to the private sectors. Right. In the four things that have been said by Mr. Chin: nephrology, cardiothoracic, cardiology services, and as well radiology and imaging. So, in that way, it's also good. Before I miss my, the main thing that you said, I come back to this point.
Yes.
Yes. Yes, they want to see improvement. But let me be upfront and honest about this. Until and unless we get to address system, delivery is going to still be the same. Meaning, we get to do personalized patient care, but of course this is not coming overnight, But at least in the care of in what I've said in the context of having digital healthcare. Digital healthcare already, by way of appointments, by way of bed management, by way of the governance and the management aspect of hospital and clinics, these are already improving. And as well, the telemedicine and the virtual clinic are as well improving outcomes by way of wait time, by way of by way of congestion. Already they are beginning to see that we are, and imagine if we can. Imagine we can reduce further, or rather invest and spend further on public health facilities. Of course, that would be best. Now, as I've stated earlier, that this is how I see two things. One is the human resource, the thing called acute shortage of specialists, and as well now nurses. They're going across the causeway. They're being paid 2-3 times more. So yeah, that is onerous. That is challenging on this minister, and there is no effective ways of managing this, mitigating this, save if I'm given the authority, ability to be paying slightly more.
Right.
Yeah, by way of even on calls, even by way of remuneration, because immediately they step out. a surgeon or even those physician, internal medicine or specialists or whatever, immediately they step out of public health facilities, easily they're getting about 3-4 times, more.
Yeah.
So of course, I don't blame them, but at the same time, it's going to be causing a heavy, dent on me. So yes, I've got to address, if at all there is acute shortages of specialists or even MOs, for that matter, sometimes even HOs, nurses particularly, especially those with post-basic, trainings. Yeah. So this is human capital, human resource. Yeah, I know for a fact that I have to address this. And even prior to this, I have to address postgraduate specialist training for that matter. But that is done now. That's done and over. Okay, behind us, right? I don't want to. But moving forward, yes, the human resource is certainly. But again, not too bad at all. By way of the metrics, as an upper middle income economy, we now have 1 doctor to 420 population. 1 doctor. But the challenge is not about that. The challenge is about distribution. Well, we have that in Klang Valley for that matter, but in Sabah, you may be looking at 1 to 800, or even in Sarawak, it's certain, so there is this inequity, there is this maldistribution, and all these are serious issues that I must address. So, Melissa, you're correct. While I want to go on big ideas of reform, I have to take the bread and butter issue, the firefighting issue, the perennial chronic problem of human resource and facilities. But again, I would want to add that it's not too bad at all. And I'm now doing and commissioning a study on supply and demand, so that I get to see whether truly is it a case of acute shortages, or is it about maldistribution, or is it a combination of both? That would be a challenge on this, Minister. But at the same time, I'm not going to compromise on my reform. I'll go headlong into, I'll bend into making sure that my report, because if I don't get to address those things on health financing, I've not touched anything on health financing as yet, and digital health, we always be in crisis. Because these are firefighting. These are issues that will not get, will not get permanent resolution or solution unless you get to understand the systemic problems of the healthcare.
So address the system to improve the delivery.
This is why we got to go. There is no quick fix into this.
Understood.
If I may, I like one of the statement YB mentioned. I always remember that YB said, "I'm not a health minister only for the public. I'm a health minister for all Malaysia." And because of that, I always remember that, right? Private is always at the back, together with the ministers. So when YB mentioned about capacity, bottleneck and all, there's always this channel of private is there to complement. Whether you're talking about number of beds, number of hospitals, and number of specialists, right? We are always there. So I think if looking at the bed distribution, it's almost about 73-27. But if you're looking at the hospital, it's on the flip on the other side and all. But we're always there. So for example, when YB mentioned about some of the NCD, right, especially post-pandemic, very, very critical. I think most of the private healthcare, what we have actually done, and in this coming MIH Megatrends, we are going to discuss in detail in terms of NCD, right? We are talking about heart and lung, neuro and stroke, oncology, orthopedics because of aging populations.
Yes.
This is where private, we are all there to actually help supporting the government agenda, right? Whether if there is any accessibilities where we can actually help to decant those services and all, and we are all going to be there. Now, if you're talking about KPJ, I think there's one thing, just now we also talk about specialist training, right? Like KPJ, because of KPJ University, we have these unique value propositions where we can actually produce masters students, postgraduate, to be able to actually help strengthen the pipeline for the government. So you're looking at some of the specialties like internal medicines, pediatrics, NS, you're talking about general surgery, orthopedics. Those are the 7 specialties where we have it all to actually support the government. So just want to make sure that ministers, you always have us beside and behind you.
Surely. I have always called for, the private sector to be also invested and into even capacity building. Yeah, and this is the way to go.
Definitely.
I call it all hands on the deck.
Okay. Well, I'm excited to see this in action, the closeness, the collaboration between public and private, and looking forward to the MIH Megatrends. So you can find out more about the upcoming conference at mihmegatrends.my. Thank you both for being on the show and sharing your insights, your analysis.
Melissa, for
I
having us.
appreciate your time.
Yeah.
Thank you, Melissa.
Thank you.
That's all we have for you on this episode of Agenda Awani. I'm Melissa Idris signing off for the evening. Thank you so much for watching. Good night.